Hi, my name's Crystal. I'm going to be talking about cystitis, basically just a term for a bladder infection of some sort. So the first thing is, what is cystitis? It is inflammation of the bladder, usually caused by a bladder infection. Now, there can be many different things that cause cystitis. Some of the characteristics whenever you have cystitis is a strong persistent urge to urinate, burning sensation when urinating, passing small frequent amounts of urine, blood in the urine, passing cloudy or strong smelling urine, pelvic discomfort, and feeling pressure in the lower abdomen, and a low-grade fever can happen as well. What causes cystitis is usually E. coli, but it really just depends on, it could depend on a lot of things. If it's bacteria, then it will be E. coli that caused it. If it's caused by something else, it could also be caused by Enterobacter, Citrobacter, Serratia, Pseudomonas, Enterococci, Staphylococci, and even fungi can be a cause, but those are more rare. It's usually E. coli. And here's a little E. coli with the way that it looks and everything. What type of agent causes cystitis? It is usually caused by bacterial infection, although it sometimes happens when the bladder is irritated or damaged for another reason. To treat a bladder infection at home, like say it's not as severe, or you're like a low risk patient, you can take ibuprofen, make sure to drink plenty of water, hold a hot water bottle, or I did read like a heating pad to like your belly, like your abdomen, your pelvic area, just to give it some relief. Avoid having sex. Also make sure to pee frequently, which usually with a bacterial infection you have to anyway. So make sure to, like, especially women, make sure to wipe from front to back. It's a lot more common in women because of that reason. Their urethra is much shorter than a man's. And then gently wash around your genitals with a skin-sensitive soap. So just make sure it doesn't have any scents or fragrances or anything in it. Usually it needs to be fragrance-free. Now, if you need to go to a doctor, there's many different treatment options. If it's E. coli, antibiotics are the first line of treatment. Which drugs are used and for how long depend on your overall health and the bacteria found in your urine. If the cystitis is caused by something that is non-bacterial, then it will depend on the causative agent for the route of medication prescribed. Here are some different medications that they might give you for bacterial. So there's nitrofurantoin, inhibits protein, the mechanism of action, it inhibits protein, DNA, and RNA, and cell wall synthesis. Usually they'll give you 100 milligrams twice a day. Just a little note about it. It says low resistant rates and risk of adverse side effects. Similar efficacy compared to a 3-day regimen of trimethoprim? And the next one is, of course, the one that I can't say, the trimethoprim sulfamethazole, something like that. And that inhibits nucleic acid synthesis by folate synthesis inhibition. So that it is used for when local resistance rates do not exceed 20% and in patients who do not have a sulfa drug allergy. which is actually pretty common. There's a lot of sulfa allergies. And you take 160 to 800 milligrams, depending on your doctor. One double strength tablet twice a day for 3 days. And then the next one is fosfomycin trometanol. I'm terrible with words. They block cell wall synthesis by inactivating enolpruvyl transferase. So transferase would be a protein of some sort. 3 grams in a single dose. Minimal resistance and risk of collateral damage. Inferior efficacy compared to other regimens. So that's probably like a less common treatment. And then pivmecilin, which is a penicillin of some sort. It disrupts synthesis of cell wall by inhibiting formation of peptoglycan crosslinks. That would be 400 milligrams once daily for 3 to 7 days. And it has low resistance rates and risk of adverse side effects, not available in North America. So this is some kind of penicillin that is not available in the United States, but it is used for bladder infections elsewhere. And then this is just like some little facts about bladder health and, ways to prevent getting a bladder infection, because nobody wants one of those. So what are some good foods for the urinary system? There's pears, winter squash, potatoes, lean proteins, breads, bananas, green beans, whole grains, nuts, and eggs are good, just to keep everything healthy. And then there's also facts about bladder health. It's normal to go to the bathroom 6 to 8 times a day. So if you feel like you're going too much, just keep that in mind. It's pretty normal to go that often. When empty, the bladder is about the size and shape of a pear. Let's see, the bladder can hold about 2 cups of urine on average. And bladder cancer is the 9th most prevalent cancer in the world. I didn't actually know that. That's interesting. And then to keep your bladder healthy, it says make sure to drink enough liquids, avoid caffeine and alcohol, quit smoking, because smoking's bad no matter what. It does everything bad to your body, so quit smoking. And exercise regularly, which also helps overall health as well. So that's always good to do, just to stay active in general. And that is it. So yeah, this is just some little facts about cystitis. Thank you for watching.